Good morning, Dr. Jaffe. We have a customer who writes in that says they have a patient that primarily suffers from digestive symptoms and want to know if you would recommend that they do an LRA food panel, or are there any other reasons why they should do a combination panel that would include chemicals?
Well, if we're living in the 21st century, then we really need to look at all the categories of problem substances, the ones that are anti-nutrients, the ones that, for example, consume the good stuff and leave behind the bad stuff. So it wasn't true in the 19th or 20th century, but in the 21st century, we really need to do comprehensive mapping of immune defense and repair systems. And yes, if the person has digestive issues, they might have maldigestion dysbiosis, they might have atrophy and enteropathy, they might have nutrient deficits and leaky gut, they might have had a history of antibiotics, or they might have been taking some other medicines that interfere with digestion. So there's a lot of moving parts when we say digestive disturbance, and it's very common. And most of the time, people initially suppress the symptoms. Well, I have dyspepsia, so I'm going to take Pepto-Bismol with bismuth. I have reflux, so I'm going to use a proton pump inhibitor rather than, say, something that would cause the muscle at the base of the esophagus to work properly and resolve the cause of the digestive disturbance. So all along the way in the digestive tract, there are issues. We know how to use physiology before pharmacology. We do recommend nature, nurture, and wholeness. We do recommend giving enough of the good stuff and keeping down the bad stuff so that you can actually repair and let your body do what it was meant to do, which is repair itself, be resilient, resistant, and if you get exposed to something toxic, it can biologically and safely remove it. That's what we recommend.